Hello everyone, welcome to my presentation. My name is Marvin Dunger and today we're going to be talking about diabetic ketoacidosis. This is a really serious medical emergency which happens to some people who have type 1 diabetes. So here are the topics that I'm going to cover in this talk, and what I want you to get away from it is a bit of revision about blood glucose and how it's regulated, what the role of insulin is in regulating blood glucose. I want to talk a little bit about diabetes and what it means when you don't have insulin or that regulation goes wrong. Then, away from the textbooks, we're going to go through a case study. What does it actually look like when someone is having a diabetic emergency? And the pathophysiology will be covering exactly what goes wrong, how it goes wrong, and which leads us onto treatment and what we can actually do about it. A small recap about blood glucose regulation. So our cells need energy, and the main form of energy they get is through glucose. So it's important to have at least some glucose. And if we don't have enough, you can actually have a hypo, which is when you lose consciousness, you might have a fainting spell because your cells just run out of energy. On the flip side, if you have too much glucose in your blood, let's talk through the process. So firstly, the cells in the pancreas, the beta cells, will detect that there's too much glucose. They will then release insulin. That insulin goes into the blood, and the effect of the insulin is it moves the glucose from the blood into the cells. So it drops the level of glucose in the blood, and that then means that the pancreas will stop releasing insulin because it's no longer detecting high blood glucose. This is a kind of a negative feedback loop, and it's a part of a process which you're all very, very familiar with, which is homeostasis, and that's just maintaining a constant internal state. There are two main types of diabetes, type 1 and type 2. Today I'm just going to talk about type 1. So the full name is diabetes mellitus, and to break those two words down, diabetes means to pass through, in this case passing through the kidneys, and mellitus means honey or sweet. So together, diabetes mellitus means passing large amounts of sweet urine. The kidneys produce urine, and they normally act like filters which don't let glucose into the urine. In diabetics, because there's so much sugar in the blood, some of it does actually overflow and it does get into the urine. And that's what gives it the name, because you then have sugar in the urine, it makes it sweet. And this disease is caused by an autoimmune destruction of the beta cells. So if there's no beta cells, they can't produce any insulin. And nowadays, it's very easily treated simply by giving insulin injections. Let's have a look at a really kind of typical case study, something that you might in reality expect to see. So we've got a 14-year-old girl, and 2 months ago, she starts feeling tired, and she's always going back and forth to the toilet. She really needs to wee all the time, and she gets the flu. Now, 3 days after she comes down with this flu, she starts to become confused. Her sentences aren't making sense. She starts getting a pain in her belly, and she's feeling really nauseous, and she ends up vomiting quite a lot of times. Her parents are obviously really worried, take her down to A&E, and as the doctors are examining her in the emergency department, they realize that her breath smells quite sweet. In starting to make sense of this girl who's been feeling a bit down for a couple of months, and then all of a sudden has an emergency, a really serious illness, the first thing to understand is that the 2 months before, when she's feeling a bit rubbish, that's the autoimmune destruction. All the inflammation, she's not feeling great, she's low on insulin, her blood sugar's probably all over the place. And what really sets off the real trigger for the diabetic ketoacidosis is a state where you have very high blood glucose and very low insulin. And things that can cause this, the most common ones are like just being ill. That could be a flu, it could be an infection, something else. And it's also missed insulin doses. So as you can see, both of these would cause a state with very high blood glucose and very, very low insulin. The sweet smell that the doctors are smelling on her breath, that is caused by ketones. Now, as cells can't use glucose because there's no insulin to bring the glucose into the cells, they actually start to break down fats instead for energy. And a breakdown product of this are ketone bodies. As these ketone bodies build up in the blood, they turn the blood acidic because they are themselves acidic. And that's what gives you the name acidosis in diabetic ketoacidosis. And that also causes a whole bunch of problems, of course. So what actually goes wrong? Let's try and relate what we've seen in the case study to what we know happens on a more cellular level. So firstly, there's high blood glucose levels. We know that because there's no insulin. And then this causes a high plasma osmolality. The plasma is just the liquid part of the blood, and osmolality is kind of the concentration. Because there's lots and lots of glucose in the blood, the osmolality goes up. We talked about how the kidneys normally don't allow any sugar, any glucose into the urine. But now, because there's so much glucose, some glucose does go into the urine. And this then draws lots of water into the urine. Because if you imagine that there's a concentration gradient between the blood and the urine, and as glucose passes into the urine, it then increases the concentration, the osmolality of the urine, and that causes water to then move down a concentration gradient by osmosis from the blood into the urine. Another way of thinking about it is that sugar passes into the urine and it pulls water with it. As a result, you get lots and lots of water loss, lots of dehydration, that's really bad, and the volume of the blood, it goes down because it's all being essentially peed out. This causes the symptoms of confusion, fatigue, and in really severe cases, it can cause the kidneys to pack in, cause kidney failure. The treatment of diabetic ketoacidosis is actually really simple. The first thing, and probably the most important thing, is just to get an IV drip going, give the patient lots of water, lots of electrolytes, all these things that they've lost because they've been weeing it all out, basically. And the second thing is just to give the insulin so you actually fix the problem behind, which is that the glucose is too high. Diabetic ketoacidosis is a really bread and butter kind of thing that all doctors everywhere need to know. It's really, really basic and it's really, really important. And I hope in this talk I've managed to link at least some of the concepts from A-level biology, maybe chemistry, into kind of a more clinical idea of what a case looks like and how it's treated. And just to recap some of the key points. So diabetic ketoacidosis, it's a very serious complication of type 1 diabetes, and it's caused by low insulin and high blood glucose. And this leads to a state of severe dehydration. The treatment's very, very simple, and it's just giving IV fluids and insulin. Thank you very much.